Hello viewers, welcome to this episode of Healthy India. Today we'll be talking about a very important organ which we haven't really discussed in this program, and that is the brain. As you know, the brain controls all functions of our body. It controls our hearing, our eyes, our speech, our heart, our breathing, the power in our limbs, all are under control of the brain. And the topic for today is brain stroke. As the term suggests, it's like the brain is struck by something. And what is that? Basically, a brain stroke results when there is interruption of blood supply to a particular portion of the brain. Now, these delicate brain cells, if they don't get blood or oxygen or nutrients, within minutes, they start dying. And that results in a corresponding, what we call neurological deficit. Meaning, if the part of the brain that controls your upper arm, your arm here, if that is damaged, you will get weakness of that part. If a part of the brain where the blood supply has been interrupted controls your speech will go. So that's how stroke manifests. That's the basics of stroke. And to discuss the details about stroke, we have a distinguished panel for you today. We have Dr. JEYARAJ Pandian from Ludhiana, Professor of Neurology and Principal of CMC Ludhiana, joining us on Zoom. And with me in the studio are Professor ROHIT BHATIA from the All India Institute of Medical Sciences, Neurology, of course, and Dr. RAJASHEKAR Reddy, who's Director of the Neurology Services at Max, New Delhi. Welcome to the show, gentlemen. We'll talk a little bit about stroke. A lot of viewers have been asking that we've spoken about heart attacks, we've spoken about diabetes, but we haven't really touched brain stroke, right? So I'll start with Dr. Pandian first, and I'm aware of your work, Dr. Pandian, in this area, about, how common is stroke in general? Why should we worry about it? Is it common? And what is the Indian scene regarding stroke? Dr. Pandian, please.
Thank you, Dr. Ambrish. And stroke is a common problem. Stroke or brain attack, we call. If you look at the Indian data, for 1 lakh population, there would be from 140 to 210 new stroke cases in a year for a given 1 lakh population in our country. And the stroke burden is equally high, both in urban and rural India. The data that we have recently published from a research done in Ludhiana rural areas, we found that it was higher than the urban figures, that is 210 per 1 lakh population. And if you look at the total number of cases in our country, it would amount to 1.8 million new cases in a year. And if you look at in a minute, probably every 40 seconds, in India, probably somebody would have a stroke. So that is the hard data. Whatever information that we have, it is, I would say, it is not completely accurate. It is understatement, I would say. It would be more than what is estimated, probably about 10 to 20% more than the figures that we have. Because in India, we don't have an accurate method of documenting the deaths due to stroke.
So, which means that stroke is quite a common condition, unlike what some people may want to think. But where does India figure in that as compared to the West, for example, in terms of the prevalence of stroke?
Yeah, so in India, if you compare with Western countries, the incidence is high. That is the new cases. And the prevalence ranges from, from 150 to up to 620 per 1 lakh population. Definitely, as compared to the Western population, the stroke burden is high. Another striking difference between the Western as well as the Indian population is the age of onset of stroke. The age at which the stroke occurs. It is younger in Indian population. Probably, the average age of our stroke patient would be somewhere between 50 plus or minus 12 as compared to a Western population, which is about 72 plus or minus 12 or 15.
So much in the pattern of heart attacks and even risk factors like diabetes and hypertension, they seem to occur more commonly in South Asians, Indians, as compared to the West. And they also seem to occur at a younger age. That's not very exciting, but nevertheless, that's the truth. And it should further strengthen our resolve to address this problem. Dr. Bhatia, what are the symptoms of stroke? How should one figure out that one is getting a brain attack or brain stroke?
Thank you, Dr. Ambrish, for bringing this topic of discussion today. I would say that this is something that our population seriously needs to know. So, stroke is something which will strike you suddenly and abruptly. And any time of the day, during the day, you may wake up with that symptom. So, the most common symptoms which we must understand and recognize are sudden difficulty in speaking. Your voice may become garbled, you are giving a lecture and suddenly, the voice becomes distorted. Sudden difficulty in understanding something that is being told to you, so you're trying to figure out what is being told, you may get a bit confused. Sudden weakness on one side of the body, abruptly, you were walking and suddenly you feel that the leg is giving way or you just can't lift the arm, you can't hold a thing which you were holding in your hand, it's trying to slip off your hand. And sudden, difficulty in seeing from one eye. Abruptly you feel that one eye vision has just gone off. Any sudden incoordination that you are walking and then you feel that you're just drifting to one side, you just can't coordinate your body, you're losing balance, or you suddenly feeling abruptly dizzy, which is out of proportion to what you were doing few seconds or minutes ago. And another important symptom is an abrupt, sudden, most severe headache you ever had in your life. So these are some very, very common symptoms of stroke. And I would also reinstate the fact that because these symptoms are sometimes difficult for people to understand, they may sometimes feel that this is just, pressure on the arm, that they've been sitting, or they wake up and they say maybe my arm was beneath me and that's the reason I am not able to just hold up, a glass of water or hold a cup of tea. But it is very important to understand that these symptoms should not be ignored. If you get any of these abrupt symptoms, you definitely need to reach a hospital.
तो डॉक्टर भाटिया ने हमें बहुत सारे सिम्टम्स बताए, कैसे हम पहचाने कि स्ट्रोक हो रहा है. बात करते करते ज़ुबान लड़खड़ा रही है, नज़र एक तरफ की विजन एकदम से कम हो गई, या एक हाथ चलना बंद हो गया, चलते चलते लड़खड़ा रहे हैं सड़क पे. तो ये चीज़ें अगर होती हैं तो ये ब्रेन स्ट्रोक या ब्रेन अटैक हो सकता है. तो आपको तुरंत अपने डॉक्टर से संपर्क करना चाहिए. पर डॉक्टर से संपर्क कभी कभी तो सभी को लगता है कि मेरा हाथ थोड़ा नम हो गया, थोड़ा दब गया, जैसे आप बोल रहे थे रात को. Dr. Reddy, doctor को when should we see a doctor, and is it urgent, or we can just watch for some time?
I think sir, Dr. Rohit and Dr. Pandian very nicely told us what are the kind of things that can happen when you have a stroke, and I think that it's important to remember this acronym, which is called FAST. F-A-S-T. This is something that I think not only doctors but other people should also know about. F is face, so if you have a deviation of your face, if you have any deviation of your arm or a drift of the arm. S is a speech disturbance of any sort, then don't waste time. F-A-S-T, F for face, A for arm, S for speech, and T for time. So if such a thing happens, these are the commonest possible symptoms of the stroke. And I think it's ideal that a patient be assessed at the earliest when they have such symptoms. I don't think that one should encourage people to think that maybe arm so gaya as a result of having slept on their arm. Now, it could be just that, but we would not like to miss a stroke in such a situation, and the patient reach a hospital as soon as possible. The reason I say this is because you nicely mentioned that it is like a heart issue. There's a blood vessel in the brain which is a problem, but the brain, unlike the heart, is not very forgiving. You have still some time with the heart maybe, but the brain cells die very quickly, and if it is not treated fast, then there will be permanent damage. And we say that in every second there are billions and billions of neurons and synapses, which are brain connections, which are lost. And we say that the brain ages years at the end of a stroke. So there are calculations that a brain has aged decades by the end of a stroke within 3.5 to 4 hours if it is not treated appropriately. So the patient must reach the hospital even if there's a suspicion of symptoms, and that's what we'd encourage everybody to do.
In one line, okay, I suspect that I'm getting a stroke and I am one of those fortunate people who has access to a hospital close by. You have to remember the data Dr. Pandian was talking about in rural India. The access to high technology facilities would not be that easy. But supposing I did, what are you going to do anyway? So, you know, the vessel is getting blocked. So.
Correct. So just like we have treatments for the heart, we have treatment for the brain also now. If a patient gets into a hospital, the first thing to rule out is if the person has had a brain hemorrhage or a stroke due to a lack of blood supply.
So that we'll discuss.
Yes. Yeah. So that's the first thing. So the moment that is done on a CT scan, there are certain modalities of therapy that can be administered immediately. And the earlier a patient is given these therapies, the more likelihood of recovery.
So what is the sort of time window here? Is there a time window where you say, if you're getting these symptoms, try and reach a hospital within what? So ideally?
For us, we would say the earliest. So we talk about the golden hour, but we have up to 4.5 hours to give intravenous therapies and up to 6 hours to give therapies beyond just standard. And in very advanced centers, there are therapies that can be given beyond 6 hours up to 24 hours. So we have certain therapies that can be given at the best centers, but the standard therapies can be administered up to 4.5 hours.
So that's very, very important information. अगर आपको इस तरह brain stroke का कुछ भी शक है, तो अगर आप 4-4.5 घंटे के अंदर आपका ट्रीटमेंट एक अच्छे सेंटर में शुरू होता है, तो ये संभावना है कि आपके ब्रेन के बहुत से सेल्स बच जाएं और डैमेज कम हो जाए. Very important points for all of you. I go back to Dr. Pandian now. I discussed in the beginning, Dr. Pandian, that it's all about interruption of blood supply to a particular part of the brain. How does this happen? What is the cause? Like at the local level, what is actually happening?
Yeah, so the number one cause of stroke in India and also globally is high blood pressure or hypertension. And if you look at the figures from India, most of the studies from the hospitals as well as from the community, the number one risk factor for stroke is hypertension. So hypertension, what happens is the small arteriole, the small blood vessels in the brain becomes diseased because of chronic or uncontrolled hypertension. As a result, there is what we call arteriosclerosis, thickening of the arteries and then clot formation. Suddenly, it gets occluded. There is another group of causes, that is cardiac causes, that is due to heart disease, irregular heart rhythm, what we call atrial fibrillation, or somebody had a heart attack and the pumping of the heart is very weak, then that leads to clot formation. So that is another number, I would say number 2 in terms of putting all the cardiac causes together. And the third one is there is thickening or hardening of the arteries in the neck and also inside the brain. We call atherosclerosis, which can occur in the neck arteries and also in the brain arteries. So this is another important cause. In addition, there are many other risk factors like diabetes, high cholesterol, excess smoking, alcohol intake, obesity, lack of exercise, and in certain regions of our country, drug addiction is one of the important causes for stroke.
So, just specifying again, when Dr. Pandian, when we all talk about hypertension, we mean high blood pressure. But is there a role of stress, like hypertension? Common sort of sometimes public feels when we say hypertension, it is the same as being very tense or very stressed. So, is there a role of stress? You were talking of high blood pressure.
Yeah, stress is also an independent risk factor for stroke, but it is closely related to when there is stress, there is so much of what we call the adrenaline or sympathetic hormones, where then that leads to constriction of the arteries, BP can shoot up, and it can affect the control of diabetes, and so it has a indirect effect on the blood vessels in the brain.
Thank you, Dr. Pandian. We were describing a stroke where there is all these risk factors are there, and there is occlusion of the artery, but there are also some strokes where there is blood leakage. So there could be a thrombotic stroke, as we say, something that occludes the artery, and the other when there is a spurt of blood inside the brain. You want to give me a line about what these two are?
Yeah, so broadly the strokes are divided into two forms, as you rightly said and was discussed a few seconds ago as well. In one, typically the blood vessel in the brain which is supplying the brain part either forms a local clot within that because the blood vessel is diseased due to fat deposition, and or the clot can come from the heart or a major blood vessel in the neck which is slowly depositing fat and cholesterol, and a small clot goes off, knocks off your vessel and the blood supply goes off. That's called ischemic stroke. Predominantly most of the strokes, about 80-85% of the strokes are ischemic type strokes.
Thank you very much. We'll take a short break and be back with you with more information about stroke.
The glorious journey of India's 75 years of independence, protection of rights, ensuring equality, to empower, to deliver justice. Laws that have defined India and its people. Laws that everyone should know. Watch 75 years. Laws that shaped India. With me, Hemant Batra, only on Sansad TV.
Welcome back after the break, and we continue our discussion about brain stroke. Dr. Reddy, I come to you now. Thrombosis, like clotting, we've discussed hemorrhage, all seem to be devastating events. But are there other forms of stroke where sometimes you may get transient weakness which are not as severe as they seem to be?
Dr. Mittal, I think that's a very important question. I think many people get very minor symptoms which they ignore. Now, like I started off this discussion today by saying that the heart is forgiving, the brain is not so forgiving. So I think it's important to remember that when people come with minor strokes. These people have to be told that they've had a minor attack. For instance, if someone has weakness of the arm or the leg just for a few minutes, it's called a transient ischemic attack. Sometimes people lose vision in the eye for a few minutes or a few seconds. It's called a transient monoocular blindness. Now, these forms of strokes, and there can be other forms too, when the patient recovers well, is the most important patient for us, because we have a person in whom we can prevent an incapacitating, debilitating stroke. Now, if this person comes, he should be evaluated in great detail. I tell these people that paradoxically, unlike a person who's had a very bad stroke and is now completely weak and bedridden, where even if we do evaluate now and treat the person, we may not recover much function. But in these people who've had minor transient ischemic attacks or transient monoocular blindnesses, such strokes are the people who we must evaluate at great length, in great detail, to make sure that we can preserve function so that they do not lose their function. So it's often hard to explain to people who are perfectly all right, look, I had just a minor weakness a few days ago and now I'm recovered completely. Why are you doing so many tests? Why do you want to give me so many medications? But I have to emphasize to them repeatedly that you're the people who are the ones to preserve. You're the ones who we have to keep normal. So I think that's a very important concept, and I think that the treatment for these patients has to be as aggressive, if not better, than people who've already had a stroke.
So very important points. This so-called transient ischemic attacks actually may be the harbinger of something worse coming on. एंड इस स्टेज पे अगर आप इलाज करेंगे तो आप आगे एक बहुत दुर्घटना से बच सकते हैं. तो अगर ट्रांजिएंट स्टेज पे माइनर स्ट्रोक के केस पे इन अ वे इट्स अ विंडो ऑफ अपॉर्चुनिटी, बिकॉज उस समय जैसे हार्ट में चेस्ट पेन एंजाइना किसी को होता है, तो अगर पहले एंजाइना थोड़ा शुरू होता है और डॉक्टर पर जाएं तो इलाज कराएं तो शायद आगे हार्ट अटैक से बच सकते हैं. वैसी ही चीज़ है कि अगर ट्रांजिएंटली आपको ये सिम्टम्स होते हैं, डॉक्टर से मिलें, पूरे इन्वेस्टिगेशन कराएं और ट्रीटमेंट लें जिससे कि आपको फुल फ्लेज स्ट्रोक से बचाया जा सके. Very important points, Dr. Reddy. Thank you. I'll go back to Dr. Pandian. We've spoken about acute management of stroke. We've discussed the symptoms. We've discussed what to do. But we know that despite all our efforts, there will be people who will get these attacks, these brain attacks or strokes. what are the long-term sequelae and how do we manage that? Because, you know, once the acute phase is over, all our new technology does not help us too much. All the advances, they somehow tend to, if I'm not wrong, tend to stop there. So A, what are the residual effects, and B, what can we do about them?
Yeah, there are two important aspects in the long-term sequelae of stroke. Number one is the disability, residual disability. What I mean is that somebody's arm and leg is paralyzed and they are not able to speak. Even they need help for all the activities of daily living, like eating, bathing, dressing, etc. They are completely dependent on others. So there has to be somebody who has to take care of them. And that is what we call the severe stroke, where recovery has not happened. And then you have a moderate disability where people will be able to walk a little bit, they would need little support, but still they are dependent. And the mild disability, like a little bit of weakness in the leg or difficulty in speaking or trouble seeing, but slowly they recover. So how to manage these group of patients with disability? Number one is they need rehabilitation, which has three components. First is physiotherapy. They need a regular daily physiotherapy, which should be supervised, or the caregiver needs to be trained. The number two is occupational therapy, particularly people with weakness in the hands, fingers, people who are young, and for example, somebody is an IT person has developed a stroke and they need their fingers to do all their work, particularly with the computers. So you need to really work on their hand recovery, that is through occupational therapy. Then third is speech therapy, where if they have language involvement, somebody who can't understand, but they can speak, somebody who can speak, but can't understand. So these are the three areas where by which you can rehabilitate the stroke patient.
Good rehabilitation makes a huge difference to the ultimate outcome of these patients. So patients who are motivated and have a supportive family and get good rehab procedures actually do much better, a few months after the stroke than those who are unfortunately left alone. So I think that's really important. We are running out of time, but quickly, what are the measures we can do in our lifestyle to prevent stroke?
I think, Dr. Ambrish, that's a very important discussion point. We generally say when we are trying to do prevention for having a stroke or let's say even a heart attack, there are two kinds of prevention. One is a primary prevention that you do as a human being from the beginning so that you don't get to the risk of having a stroke or a heart attack. Now, typically, we encourage people to, maybe at least once in a while check their blood pressure, do not smoke, address alcohol issues. Lifestyle definitely includes, regular exercise and of course, your diet, which should be rich in fruits, vegetables, less in fat. But when a patient has actually had a stroke, and that's the time when we need to further encourage their prevention, and that time the lifestyle issues become more critical. And I think that's the time when we really encourage people to, if they are hypertensive, which means they have high blood pressure, they need to take care of their blood pressure, they need to monitor the blood pressure and report to the doctor if the blood pressure is not getting controlled. Many times you see people come back with a stroke and they have kind of lost that instinct to really monitor and come back to the doctor. The second is get over any addictions that you've had. For example, if you've been a smoker, then with proper counseling and advice, you definitely need to quit smoking because that's a very strong risk factor for stroke. And the same goes true for alcohol. Now, for people who had a stroke, many times they are not able to do exercises in the beginning, but as they start to recover, we also encourage them to start walking, start doing further, static or walking exercises, and of course, diet modifications, which is typically diet which is low in cholesterol, low in carbohydrate, low in salt, but high in proteins, vegetables. So there is another important point, Dr. Mittal, which I would like to also address here. We've talked about lifestyle, is that there are two components. One is that we see a lot of people in their 40s and 50s, and as Dr. JEYARAJ has already pointed out, that we are a country with younger younger age stroke population. And it is very sad to see people coming with, significant intracerebral hemorrhage, which is devastating for the patient and the families because they knew they had high blood pressure, but they ignored it.
बहुत important बातें बताई हैं आपने. ये बताया कि सबको अपना ब्लड प्रेशर और शुगर और जो भी और रिस्क फैक्टर्स हैं उनको कंट्रोल रखना चाहिए स्ट्रोक से, ब्रेन स्ट्रोक से बचने के लिए. वही आपके ब्रेन को बचाएगा, वही आपके हार्ट को बचाएगा, वही आपकी किडनीज को बचाएगा. तो अगर हमें अपने आप को सेफ रखना है तो ये बेसिक मेजर्स अपने डायबिटीज़, ब्लड प्रेशर, कोलेस्ट्रॉल, इनको कंट्रोल में रखना ज़रूरी है. लास्ट क्वेश्चन ऑफ द प्रोग्राम टू डॉक्टर रेड्डी, and that's about, we talked about lifestyle, but what medications are used to prevent stroke?
Right. So I think Dr. Bhatia here very clearly mentioned primary prevention. Now we talk about secondary prevention is after one has had a stroke, what are the medications that one must take? So I think there's a group of medications that must be taken to control the risk factors that are going to be in play once a person has had a stroke also. So that is controlling your blood pressure, controlling your sugars, controlling cholesterol. And apart from this, there might be a few more medications also. Now, broadly, like I said, there are two types of stroke. In a brain hemorrhage, you will not give a blood thinner. And for all other types of stroke, which is 80% of strokes, where there is lack of blood supply to the brain, you must give a blood thinner. Now, that blood thinner choice is dependent on where the stroke is found to have originated from. In about 30% patients, I would imagine that the origin is the heart, so the blood thinners are slightly different. If there's a blockage in the blood vessels in the neck, blood vessels which are going to the brain or inside the brain, then the blood thinners which are given are different. So broadly, there are blood thinners to be given to people with ischemic strokes, and we control the risk factors also. And I think that I must here emphasize that medications are important in people who've had TIAs also, so that they do not go on to develop full-fledged stroke. Another thing I also want to emphasize here is that some people come and tell me, and I thought it's a point I should make, that we've done everything right and we've still had a stroke. And in my experience, I have seen that people who've done everything right usually recover better from a stroke. I think that those people actually recover better, and I don't think that this would be something I could say is really data-driven, but it's certainly personal experience that I'd like to share with everyone.
I think that's important, and for nothing is 100% in medicine. When we use drugs to prevent heart attacks, it's never 100%. You know, you learned that in COVID. Whatever else you might do, it's never 100%. So we have to remember it's biology, it's never 100%. We are only reducing our risk. तो हमारे experts ने हमको बहुत अच्छे से आज बताया कि stroke इंडिया में common है, brain strokes इंडिया में younger लोगों को होते हैं, कम उम्र में होते हैं, और इसका विशेष कारण हमारे यहाँ रिस्क फैक्टर ज़्यादा होना ही है. जैसा हार्ट में हमने डिस्कस किया था कि क्योंकि हमारे यहाँ यंगर एज पे ब्लड प्रेशर हो रहा है, उसको हम लोग ट्रीट नहीं कर रहे, डायबिटीज़ इनके सिम्टम्स नहीं होते, इनको ट्रीट नहीं कर रहे, कोलेस्ट्रॉल, ये सब चीज़ों की जांच, मतलब अपनी डाइट ठीक रखना, अपना वज़न ठीक रखना, ओवरवेट, ओबेसिटी से सब कुछ बढ़ता है, ये सारी चीज़ें एक साथ. तो ऐसा नहीं है कि हमें ब्रेन स्ट्रोक के लिए कुछ अलग करना है और हार्ट के लिए अलग करना है और किडनी के लिए, सब के लिए वही डाइट है जिसमें रिफाइंड कार्बोहाइड्रेट कम होना चाहिए, तली हुई चीज़ें कम होनी चाहिए, प्रोटीन ज़्यादा होना चाहिए, फाइबर ज़्यादा होना चाहिए, फ्रेश फ्रूट्स एंड लोकली ग्रोन वेजिटेबल ज़्यादा होने चाहिए. इसके बावजूद अगर हम सब करने के बाद भी अगर हमको स्ट्रोक की कुछ साइंस लगते हैं जो बताए गए, तो हमें तुरंत डॉक्टर से संपर्क करना चाहिए, डिले नहीं करना चाहिए. अगर आप हॉस्पिटल टाइम से पहुँचेंगे तो आप अपने आप को बहुत हद तक बचा सकते हैं. दैट्स इट on today's show, and we'll meet again next week on Healthy India.
Why does diplomacy